Does family history of other mental illnesses affect schizophrenia risk? Have you ever wondered how much your family history can impact your mental health? When it comes to schizophrenia, family history plays a significant role. But what about other mental illnesses? Does that also matter? Let's break it down. Family history is a major factor in determining the risk of developing schizophrenia. The strongest link is with first-degree relatives, like parents or siblings, who have been diagnosed with schizophrenia. For instance, if you have an identical twin with schizophrenia, the chance of you developing it is about 48%. If one of your parents has schizophrenia, your risk increases to around 13%. Now, let's consider family history of other mental illnesses. Studies show that relatives of individuals with schizophrenia often have higher rates of other psychiatric disorders. This includes conditions like schizoaffective disorder and bipolar disorder. These disorders share some genetic and biological connections with schizophrenia, which suggests that there are overlapping risk factors. For example, if a family member has bipolar disorder, it can increase the risk of developing schizoaffective disorder. This condition may act as a genetic link between schizophrenia and bipolar disorder. While having a family history of these other mental illnesses does not raise the risk of schizophrenia as strongly as having a direct family history of schizophrenia, it is still a meaningful factor. In fact, a family history of any psychiatric disorder can correlate with a worse outcome if schizophrenia does develop. This means that being aware of your family's mental health history is important. It can help identify individuals who may be at a higher risk and guide early monitoring and intervention strategies. Recognizing early signs of schizophrenia can be more effective when you consider a broader family psychiatric history. This allows for a more thorough evaluation of risk. In summary, while the strongest predictor of schizophrenia risk is a family history of schizophrenia itself, having a family history of other mental illnesses like bipolar disorder and schizoaffective disorder also plays a role. Understanding this broader perspective can be helpful for early detection and management of schizophrenia.